You've been advised to have a colonoscopy. This test has been shown to be important in the early diagnosis and treatment of colon cancer, evaluation and treatment of inflammatory bowel disease, and other conditions such as colitis, diverticulosis, and rectal diseases. Colon cancer is the #2 cause of cancer deaths in Coles County, and the early diagnosis and prevention by removal of precancerous polyps are important. Since colonoscopy has been recommended as a routine screening tool, colon cancer has decreased in incidence. Typically, colon cancer has no symptoms in the early stages. Blood in the stool and pain are usually later symptoms. Family history of colon cancer does increase the risk, but 70% of persons with colon cancer have no family history. Other risk factors include cigarette smoking and ulcerative colitis. There are other options for colon cancer screening, and these include sigmoidoscopy plus barium X-ray and a CT scan procedure called virtual colonoscopy. These techniques may find colon abnormalities, but cannot be used to confirm, biopsy, or treat polyps, which would require a second procedure. Colonoscopy is accomplished by placing a fiber optic tube in your colon via the rectum. This scope is attached to a video screen, and the colon is carefully examined during the insertion and removal of the scope. If a polyp is found during the examination, it can be moved through the scope. Initially, the polyp is identified and then surrounded by a coagulation snare. Electricity is then placed through the snare to coagulate the base of the polyp and then removed with a cutting current. The polyp can then be removed for physical examination by the pathologist. Sedation is used during the examination to create comfort. You may feel a feeling of pressure or bloating during the examination or following the procedure. The scope will last someplace between 10 and 40 minutes, and you will be required to stay within our recovery area for about 1 hour. The colon preparation is a very important part to an accurate examination of your colon. It is vital that we see all of the structures. 1 week prior to the procedure, avoid aspirin and aspirin products, medications such as Aleve, ibuprofen, or other types of arthritic anti-inflammatory medications. Coumadin needs to be stopped at least 5 days prior to the procedure. Tylenol or acetaminophen may be used for pain control. Bulking agents such as Metamucil may make it more difficult to prepare your colon. The day before the colonoscopy, stay on clear liquids. That's any fluid that you can see through. That may be coffee or broth or fruit juices. But avoid any preparation that is red. Red Jell-O, red Gatorade, red juices will make it more difficult for us to visualize your colon. Miralax is an over-the-counter preparation that we now use to help prepare your colon. You can mix that in water or in Gatorade, as long as it's not red, and use that for a tastier preparation. Ducalax, also available over the counter, can be utilized to help in the preparation. You drink 8 ounces of the Miralax solution every 30 minutes until it's gone, and that's going to take you 4 to 6 hours. Drink the whole thing. It's important to get yourself clearly flushed out so that we can clearly see the colon. This prep is going to cause loose stools, so be very close to a restroom. Keep drinking because liquids will help flush out that colon and also help maintain hydration. By midnight, you should stop drinking. Then nothing to drink or eat prior to the time of the procedure. Do not eat or drink anything the morning of the procedure. That means a cup of coffee, that means a glass of juice, that means a glass of water. It's very important that your stomach be empty at the time we do the procedure. someone must drive you home. And that someone must stay in the facility the entire time of your procedure. They can't go shopping. Leave jewelry at home. Plan to spend 2 to 3 hours at Carl on the day of the procedure. Again, you cannot drive home and you can't work on the day of the procedure as a result of the medications. If you have any questions about that, please give us a call. Now, this is a surgical procedure, and there are some potential complications of colonoscopy as a result of removing products such as polyps from the colon. Those include perforation, bleeding, and very rarely death. Colonoscopy is a surgical procedure that does involve sedation. Overall, it's a safe procedure performed thousands of times without complications. I hope this has been helpful to you in your understanding of the reasons for colonoscopy and the potential benefits and risk of colonoscopy.